Hi, this is Chirag Kumar Patel, and I'm recording this vlog of 10 minutes for my APEA remediation. The biggest subject that I have during the exam is the cardiac regurgitation, urinary incontinence, diagnosis of depression according to DSM-5. So first, I'm starting with the cardiac regurgitation. The cardiac regurgitation refers to a condition where a heart valve does not close properly and allowing blood to flow backward through the valves instead of forward. And the types of cardiac regurgitation are the mitral regurgitation, aortic regurgitation, tricuspid regurgitation, and pulmonary regurgitation. The mitral regurgitation occurs when the mitral valve, located between the left atrium and the left ventricle, does not close completely. While aortic valve regurgitation occurs, the aortic valve, located between the left ventricle and aorta, does not close completely. The tricuspid regurgitation occurs due to the tricuspid valves located between the right atrium and the right ventricle does not close completely. And the pulmonary regurgitation occurs due to the pulmonary valve located between the right ventricle and the pulmonary artery that does not close completely. The causes of the cardiac regurgitation is congenital heart defects, the infections like endocarditis, rheumatic heart disease, prolapse of the valve leaflet, or damage to the valve from a heart attack or surgery. The symptoms of cardiac regurgitations, shortness of breath, fatigue, chest pain, palpitation, and swelling in the legs or feet. Diagnosis may be done by the physical examination and echocardiogram or ultrasound of the heart. And treatment plan depends on the mild cases may not require treatment or medications like a diuretic or blood thinner, and in severe cases require surgery to repair or replace the faulty valves. And complications due to the faulty or cardiac regurgitation may be the heart failure, stroke, and pulmonary edema. And the second big subject is the urinary incontinence. The urinary incontinence is the involuntary loss of urine. It can range from a few drops to a complete loss of bladder control. There are many types of, four or five types of the urinary incontinence. First is a stress incontinence, urgency incontinence, overflow incontinence, mixed incontinence, and functional incontinence. The stress incontinence is due to the leakage during activities that increases abdominal pressure, such as coughing, sneezing, laughing, or exercising. Urgency incontinence is a sudden, strong urge to urinate that is difficult to control, often leading to leakage. Overflow incontinence is a leakage due to overflow bladder that can empty completely. And mixed incontinence is a combination of stress and urgency incontinence. Functional incontinence is due to the inability to reach the toilet in time due to physical or cognitive impairment. The causes of the urinary incontinence is due to the many factors involved. The first one is the weakening of pelvic floor muscles, second, nerve damage, third, bladder overactivity, fourth, urinary tract infection, fifth, certain medications that may cause the urinary incontinence, or the pregnancy and childbirth, also menopause and aging, also the factors contributing to the urinary incontinence. The symptoms of urinary incontinence is involuntary leakage of urine, strong urge to urinate, difficulty starting or stopping urination, and frequent urination. For the diagnosis, medical history and physical examination, urine test, pelvic floor muscle evaluation, and cytoscopic or urodynamic testing. The treatment involved in the urinary incontinence depends on the underlying cause and severity of the incontinence. The options includes the lifestyle changes, example weight loss or pelvic floor exercise, medications to control the urinary incontinence, bladder relaxant and anticholinergic. In some cases, or surgery, example like sling placement or bladder augmentation, and interventional therapies, example nerve stimulation or Botox injection. And the prognosis of the urinary incontinence depends on the underlying causes and treatment effectiveness. Many people with urinary incontinence can manage their symptoms and improve their quality of life without appropriate treatment. And the third one is the birth defects, also known as congenital anomalies or structural or functional abnormalities that are present at the birth. They can affect many parts of the body and range in severity from mild to life-threatening. The birth defects can be classified into various types, including structural defects, metabolic defects, chromosomal defects, neural tube defects. The neural tube defects is development of the brain and spinal cord, such as spina bifida and anencephaly. The chromosomal defects is abnormality in the number or structure of chromosomes, such as Down syndromes and Edwards syndromes. Metabolic defects is due to the body's ability to process certain substances such as phenylketonuria and Tay-Sachs disease. Structural defects, abnormalities in physical structures of the body such as cleft lip and palate, heart defects, and limb malformation. And the causes of the birth defects are often complex and multifactorial. Some factors that can contribute to the risk includes genetic factors, environmental exposure such as smoking, alcohol use, and certain medication during the pregnancy, or maternal infection during pregnancy, and nutritional deficiency also big contributions in the birth defects. Diagnosis made before and after birth through various methods such as prenatal screening tests such as ultrasound and amniocentesis, physical examinations after birth, or genetic testing. Treatment for birth defects depends on the specific type and severity. Some defects may require surgery, medication, or intervention and improve functional and quality of life. The prevention of the birth defects, while many birth defects cannot be prevented, and some measures can help to reduce, such as the maintaining a healthy lifestyle before and during pregnancy, avoiding smoking, alcohol, and certain drugs, getting vaccinated against certain infection, getting enough folic acid before and during pregnancy. And the last one is the diagnosis of depression according to DSM-5, the Diagnostic and Statistical Manual of Mental Disorder. There are at least five of the following symptoms over a 2 weeks period that need to be present to diagnose the depression. Depressed mood, loss of interest or pleasure, weight changes, sleep disturbance, psychomotor agitations or retardations, fatigue, guilt or worthlessness, concentration impairment, and suicidal thoughts. And other symptoms include appetite change, feeling of hopelessness, or being overwhelmed. Physical symptoms like these are the symptoms to be diagnosed with major depressive disorder. The symptom must be changed from previous functioning and not clearly attributed to another medical condition. So here I am ending my vlog video due to the time constraint. Thank you.